About 1 in every 100 people has epilepsy. It's the most common neurological condition in the world and affects anyone at any age. In fact, about 7 to 8 of those with epilepsy will have had their first seizure before the age of 20. Today we discuss epilepsy. We will unpack everything you need to know about the condition. We'll also learn how to recognize that someone is having a fit or seizure and leave you with tips on how to handle that situation. Hello and welcome. I'm Dr. Sello Motaung and this is Our Talk.
Epileptic seizures are often traumatic electrical storms in the brain that affect about 1% of children. It is not a mental disorder but a physical one. A single seizure may not mean that the child has epilepsy. When a child has a seizure, it is important to stay calm and keep them safe. Seizures come in many different forms. A child may look like they are daydreaming, may hear sounds that isn't there, or may fall to the ground and tremble.
Yes.
Can you talk to me?
Often, a child having a generalized seizure will not remember anything about it and cannot describe his or her symptoms. Your child is an expert about their own symptoms, so create opportunities to find out how they are feeling. Talk to them. Use artwork to help them express their feelings, or use books about epilepsy to encourage discussion on what it's like to experience a seizure. Many people are scared when they see someone having a seizure. You can help your child by staying calm. Reassure them and others around you that everything is under control.
Epilepsy can develop at any age, regardless of gender, ethnic group, or intellectual ability. Just how does this condition develop and how does it affect us? Well, let us welcome our special guest who's going to help us understand this condition better. And this is Dr. Mika Mukabani, who's a specialist neurologist based at the Milmed Hospital in Pretoria. Welcome to Health Talk.
Thank you.
Let's just understand what this condition epilepsy is. We believe that there's different types. What is it actually?
Epilepsy is a chronic neurological condition which is characterized by a recurrence of seizures, 2 or more seizures which occur within a period of a year.
Right.
And of importance is that these seizures should not be provoked. That is, there should not be an immediate reversible cause to the seizures, like electrolyte imbalance, low glucose in the blood. In the blood.
All right, we'll get back to the causes. Now, when we say seizures, obviously we're talking about, in simple terms, a fit.
Yes.
Okay. What happens actually in the brain when somebody is having a fit? Is there some problem in the brain, or could it be something that causes this?
Actually, what happens when a person has a seizure is that all of us, we've got electricity in the brain.
Right.
But sometimes the electricity can become abnormal and excessive, thus resulting in a seizure.
Right.
So, and the most common manifestation, or that people are easy to recognize, are the jerkiness, the generalized tonic-clonic seizures. But there are other, presentations.
Okay, so you're saying basically the one that almost everybody knows is, where somebody just collapses and goes into, a fit.
Yes.
And you're saying that there could be other forms. Just take us through them.
Yes, there are other forms of epilepsy or seizures. The generalized tonic-clonic seizures are part of what we call primary epilepsy, where we can have tonic-clonic seizures, atonic seizures, where somebody just loses tone and falls, or they just become stiff.
Okay.
And also you can have myoclonic jerks, that short jerky-like movements.
Right.
But there are complex seizures, simple seizures, and or what you call complex partial seizures, where a person just has an impairment of consciousness. They don't necessarily lose consciousness. They have cloudiness of consciousness.
Okay.
They become unresponsive, and they can have motor movements, the jerkiness of probably one side of the body. They can have sensory seizures as well, where they feel like part of the body is not there. And sometimes
so maybe if I can then just go back a little bit. So it's possible then that you may be talking to someone, having a conversation, as suddenly somebody just keeps quiet and looks like he or she is confused, and when you kind of try and evoke some sort of response from the person, and you don't get any, or you might get a bit of a movement. Is that basically what you said?
Yes, that's basically what I'm saying.
Okay.
That sometimes, they can just start now talking irrelevantly.
Right.
Yes, and have abnormal behavior.
Yeah.
They can even have mood symptoms where they look like they're depressed, or they become suddenly overexcited for no apparent reason.
Right.
And also sometimes they can have epileptic anger, which is not very common, but I've noticed that it doesn't look like temper tantrums which are provoked.
Yeah.
It just happens on its own and just abates on its own as well.
Do we actually know what causes these things? Is it just something that goes wrong for no apparent reason, or is there some outside factor that causes this condition?
In the majority of cases, the causes of seizures are unknown, or the causes of epilepsy.
Right.
But there are epilepsies which run in families, meaning that they've got a genetic component. And sometimes people can have seizures as a secondary to trauma or infections.
Right.
And even after someone has had a stroke, they can now have epilepsy.
Does it then become permanent, or can somebody suffer from epilepsy only for a shorter period of time and gets over it, as it were? What sort of seizures are those?
The interesting thing about absences is that usually the child will go into a stare, or just a blank moment. They just stare into space for a short duration. And these are the seizures usually which are missed. And usually these children, because at that time when they have that impairment of consciousness for a short duration, they are not learning anything.
Yeah.
So they present usually with poor performance in school.
So it's important for the teacher to be able to recognize these kind of
very
things.
important.
Then what are the long-term effects of epilepsy?
The long-term effects of epilepsy is that the one first implication is that one has to be may have to take anticonvulsant, for the rest of their lives, because it's a chronic medical condition. And epilepsy can also, affect one's lifestyle, the quality of life, in the sense that, sometimes it limits you in terms of certain occupations, like an occupation where you have to be on heights, or even, use machinery and so forth. Occupations that involve driving.
Yeah. Is it about epilepsy that's controlled, or epilepsy that's not controlled?
Epilepsy that's not controlled, but of course, even with epilepsy that is controlled, because by control, we mean that if you have 2 seizures or less.
Right.
So one can have
2 seizures or less
in
how
a
long
month. In a month, yes. That's good control.
Okay.
And of course, one does get, breakthrough seizures. So if you are a driver, one can get a seizure, then get involved in an accident. And that's posing a threat to other people as well, and to yourself. So it is very important that one should understand the condition of epilepsy. It's a condition that one can live with and have good quality of life, but one needs to be educated about, and the public at large.
You see, one of the reasons why I was asking the long-term effects, there's this notion that each seizure or each fit is associated with some level of brain injury. Your comment?
There are many people who are living with epilepsy, who are professionals and leading productive lives.
Right.
But if a person, for instance, gets a prolonged seizure, if it's not properly managed within the first hour of its occurrence, yes, one can have a cognitive impairment. In adults and in children as well, they can end up, with learning difficulties and so forth. So it's very important, to know how to control and manage seizures, and when to get help when a seizure goes beyond, the normal.
Now we're going to have to come back to that aspect a bit later on. Okay, what is it like to live with epilepsy? Well, more on that after the break.
Having epilepsy is not a death sentence. It's really a condition that needs to be managed.
The The judge slammed corruption in both the private and public sector. Referring to irregular and wasteful government expenditure, he said it could no longer go on.
The high-profile corruption scandal has dominated Spain's headlines in recent weeks. The scandal touching a nerve as Spain emerges from its downturn after a slew of corruption cases involving politicians and the king's sister.
Tourism is a vital part of the economy. It contributes about 5% to the country's GDP and is a significant contributor to various industries such as food production, retail and transport.
For all your business news, stay tuned to your favorite channel, SABC News, at 1 Monday to Friday.
What do famous people like Vusi Mahlasela, Danny Glover and Jonty Rhodes have in common? Well, they all have a condition known as epilepsy. In fact, 65 million people worldwide live with this condition. Living with epilepsy can be hard. Yet many people can effectively manage their condition and lead productive lives. It is not a mental disorder, but a neurological condition. Talented Miss SA teen finalist Nicole Lexton won't let anything stop her from living her life and achieving her goals.
Having absence epilepsy from the age of 9, really during that stage of my life didn't impact me greatly because I was young, I was carefree. I wasn't really worried about the condition. I wanted to carry on with my life as any other young child would, and I think my parents facilitated that and they really helped me with that process.
As ambassador for Epilepsy South Africa and working for other charities, Nicole contributes to the organization's programs for children and volunteers her time speaking about epilepsy and thereby raising awareness on the condition.
I think the biggest thing for me was, well, I have a condition, what will my peers think? And I can either be open to them, which I was encouraged to by my family so that they could understand my condition, or I could keep it to myself.
Many children and young people her age live productive lives with epilepsy that is well controlled on medication. This self-confident, young, talented and outgoing lady struggled with epilepsy and seizures as a child.
One of the most critical things and advice that I can give a parent who has a child living with epilepsy is first of all to accept that your child has the condition, because without acceptance you cannot deal with the problem. And once you have that, you then need to obviously guide your child through the process, because the early years are not as difficult other than you managing her medication, going for your regular checkups with the neurologist, explaining what the after effects are and trying to stabilize your child.
Like many people with epilepsy, she is lucky enough to have had the condition well managed, and this has allowed her to pursue her career in graphic design and photography.
Having epilepsy is not a death sentence. It's really a condition that needs to be managed.
I used to think that I could not go on if I can see it, then I can do it if I just believe it. There's nothing to it. I believe I can fly.
Now, epilepsy is known to affect people in many different ways, depending on the type and severity of the condition. This condition has an impact on sufferers and those around them. So finding ways to cope with epilepsy and live normal lives is of paramount importance. To give us some insight into a family living with epilepsy, we welcome onto the show Nicole and Danica Lexton to give us a perspective on this condition. Welcome to Health Talk.
Thank you.
Right. Perhaps let's start with you, Nicole. You have epilepsy, and you've had epilepsy for a while now. Tell us about it.
I think my parents mentored me through the process. So it was really my teen years where I was responsible for taking my own medication, that I had a larger understanding of the condition and what it meant to me and how it would impact my life, because my parents had to educate me and obviously my neurologist in terms of what type of things I need to avoid and what kind of lifestyle I need to lead in order to be healthy and manage the condition.
Okay. But how did this condition affect you as a child? Did you have any problems perhaps with your friends at school?
You know, I was always encouraged to be open about the condition.
Right.
So there's a flip side to that.
Yeah.
I had friends who supported me, and those were my close friends. But then on the social aspect, there was a lot of teasing. So I'd go out, let's say, and the people that did know about it would try to probe a seizure by switching lights on and off, because to them it's a joke because they're uneducated about the condition.
Mm-hmm.
So there was a lot of, I had to deal with that side of it, and the peer pressure of push to drink alcohol, let's say, and drug abuse in your teenage years, and having to say no to that.
Right.
But then on the other side, I had obviously very supportive family and friends who guided me through the process.
Okay, so you managed to cope with the condition?
I think, no, definitely.
Okay, and tell us about now. I mean, are you...
I'm confident, and I know who I am now. So for me, the condition doesn't bother me. I'm open about it, and I'm happy to talk to anybody about the condition.
Right.
It's really something I just need to manage in my life. It's not a death sentence.
Right. Dr. Motaung, I mean, she mentioned there that a lot of what she did also came from the neurologist. Your comment in terms of, what sort of support is given to children with epilepsy from your perspective as a neurologist?
It becomes very important to involve the whole family in the management and treatment of epilepsy, that they should understand what the condition is all about, and importantly, like Nicole mentioned, that she has an insight into what epilepsy entails.
Mm-hmm.
And also, one has to educate even further than the home, in school, for instance, that teachers should know about this condition and how they should protect children with epilepsy and how they should manage them when they get a seizure at school, because there are children who drop out from school because of improper management of epilepsy. Yes.
Well, let's get a perspective from a mother now. Danica, you've raised a child with, and of course you continue to raise this beautiful child with epilepsy. Just take us through, from a parent's perspective, what is it like to raise a child with epilepsy? What did you go through in the initial stages?
Gosh, I think initially when she was diagnosed with epilepsy, it came as a shock.
Mm-hmm.
No, there was no proper understanding of why she had it. There was nobody in the immediate family that had it. Yeah. And I think for us as a family, we decided we have to accept this condition and we have to help her to deal with it. We were all, on territories, uncharted territories, and we were going to jointly manage the process.
Was it something new in your family?
Completely. We don't have a history of epilepsy in the immediate or extended family. So, and the furthest that I knew about epilepsy is I had a neighbour that had epilepsy. That is as much as I knew about the condition.
Right.
So we had to do a lot of homework ourselves, a lot of research to kind of understand what she could expect and how we would have to assist her in the management thereof. Yeah. I think in the early years, critical was obviously taking care that she got her medication and the dosages correctly, making sure that we saw the neurologist and gave them feedback as to her condition and if we were concerned about anything, because I think that relationship is very, very important.
Yeah. Doc, if we can just come back to you. You mentioned, what Nicole mentioned was something around having to learn about taking medication and the side effects and what have you. Quite often you get parents obviously bringing children to you. Your experience in terms of parents' expectations of the condition and how quick the condition should respond and so on. Your comment, please?
A lot of parents, they expect that once a child is started on epilepsy, for instance, that they will no longer have a seizure ever again. So it's important to mention to them that control of epilepsy doesn't mean the absence of seizures, but the reduction of the frequency thereof.
Yeah.
So it is important to take the medication. If the child, for instance, develops side effects, because that could be one way, that could be a trigger for one to stop medication, then you have to deal with those side effects. There are, in certain instances, one has to reduce the dosage or even change to another drug. There are quite a number of drugs that one can use, so the option is quite wide.
Okay. Let's get your perspective then. What did you go through? Were there any challenges around giving her medication and ensuring that, she sticks to medication?
A lot of challenges, actually. Right. I want to speak from personal experience where Nicole is concerned. Yeah. Particularly when she was in between grade 10 and 12, we were going through a phase where she was not stable. And so there was quite a lot of changes in the medication to try and find the right one, that would optimize her condition. And as a result, we were having to wean off, wean on. And that in itself is a process. And you have to follow that cycle quite carefully and go back then for checkups with the neurologist. So that was important. The other thing is, as the doctor mentioned, to watch the side effects. Nicole became extremely depressed on the one set of medication that she was prescribed. So not only was I dealing with a child that had medical condition, I was now having to deal with these psychological effects as well. And particularly in the teen years, you have to manage that very, very closely.
Yeah. So it can. So tell us more about the depression now. How long was that period? Was the depression
I think it was,
because of the condition that she knew she had epilepsy, or was it? How did you work out that it depression as a result of side effects to medication?
Nicole has always been a very outgoing, energetic, confident child. So I didn't put the depression down to anything that was particularly happening in her teen years. I've got a very close relationship with her, so we were very open and honest about a lot of things, and I would have picked up on something quite quickly if there was an issue related to that. She was very depressed. She was lashing out at kids at school. She was angry. And we saw that change. It was quite evident. And it was my daughter. She went and spoke to my eldest daughter and she said, I don't know what's wrong with me, but I just want to kill myself. And when you hear that sort of comment as a parent, you kind of immediately realize, you know what, this is not normal for Nicole, because this is not who she is. We know our children. And I took the package insert out of the medication. I read through the side effects, and there it was, severe depression. And that's when I've picked up the phone and I said, I need an appointment with a neurologist. And I went to him and I said, I want my child back. Please, let's look at alternative medication. And that's why I think that relationship and that rapport with your neurologist is very important, and that you need to give them that feedback so that they can then take the steps necessary to obviously medicate differently.
Yeah. Well, let's get your comment, around depression. Maybe let's just, before we get to medication, because we'll talk about side effects and so on, when we talk treatment, just in terms of the effect that the condition can have on the psychological and mental well-being of both the sufferer and those that are around the sufferer. Your comment?
I mean, people with epilepsy, if for instance, they have difficulty dealing with the condition, and especially the difficulty coming from it being imposed by outside people, like children teasing them and living under stressful conditions as schooling. Being bullied because, they have the condition of epilepsy. They can end up depressed like anyone else, in the population. Yeah. But it's also important to know that some medications also can push one to becoming depressed. And also, one can present with depression as part of a seizure complex, where 1 minute the child is okay, then the next minute that they have intense depression, and meaning that they have mood symptoms. Sometimes they can be overexcited and so forth, and they can even commit suicide. It has been documented that suicide related to the condition of epilepsy.
So a
holistic approach is also very important, where one needs to work as well with other healthcare professionals, like psychiatrists, to diagnose true depression in someone with epilepsy as well. And from the doctor's side, also, when that happens, to get proper history. And if it's a medication that's causing the depression, it was to stop the medication. Yeah. So it's very important to work very close, with the healthcare professionals or even the neurologist.
Yeah. Well, Nicole, we're talking around you. We're getting a perspective from your mother. We're getting a perspective from the doctor. Tell us about what you went through psychologically.
I think the biggest thing was the change in lifestyle. Well, it wasn't a great change, but just understanding the condition and how it would affect me if I had to do certain things. So driving was a concern to my parents. My mom and dad often have to drive me to places.
So driving in what sense? You driving or your parents having to drive you somewhere?
My parents having to drive me somewhere.
Okay.
I'm at the age where I want to drive myself. I want that freedom.
Right.
And it is limited.
Okay.
Peer pressure, obviously. I think having a healthy and balanced lifestyle.
Yeah.
So my sleep's important, my diet's important.
Yeah.
There were just those few considerations that I had to now actually consider, whereas before it would just be something that happened naturally.
Yeah. But it's important that, what was described a few minutes ago was this Nicole who was very depressed, threatening suicide, going through a very difficult time. And that you're now saying, you're the ambassador for Epilepsy South Africa, by the way, and Ms. Teen SA, you're living a wonderful life, and you're saying that you managed, with the help of your parents, obviously with the help of the neurologist and everybody else around you, you managed to overcome all of that and to live a normal life, correct?
Correct, and I never saw epilepsy as something that would ever get in my way. It was a condition that needed to be managed, and that was that. I was going to continue to pursue my dreams as I was before I even knew about epilepsy. So I have dreams, and I'm never going to let a condition stop them.
Right. Wonderful. Wonderful message to end on. And maybe on this note, let me say thank you very much for contributing to our show, and keep up the good work, your role as ambassador for Epilepsy South Africa, and all the best. Yeah.
Thank you.
And thank you to Nicole's mum as well.
You're welcome. Thank you very much for the opportunity.
All right. So is epilepsy curable? We'll find out after the break. Please stay with us.
SABC, sharing 20 years of inspiration.
Slow motion playback on our new waterproof smartphone. Don't settle for good, demand great. The new Sony Xperia Z3 series.
Demand great and get the waterproof Sony Xperia Z3 smartphone with a 20 megapixel camera for only 499 Rand per month on a smart small contract this summer. Power to your best summer in 20 years. Vodacom. Power to you.
We live in a digital era, and the number of Africans with mobile phones is rapidly increasing.
Twitter use is predominantly being done on smartphones. This is a very African phenomenon.
Here, there are constantly new innovative ways to make the internet more affordable. With that, we're seeing protests against governments proposing methods to limit access. On Network, we give you information about all of this. We also have new computers, games, and robots.
Join Siphumelele Zondi on Network every Sunday at 19:30 CAT.
Is epilepsy curable or controllable? Can treatment restore normal lives in all sufferers? To help us with these questions and more, we still have our special guest, Dr. Mika Mukabanu, who's a specialist neurologist at Milmet Hospital in Pretoria, and we're now joined by Magdalene Creer, who's Director for Epilepsy South Africa. Welcome to Health Talk, Magdalene.
Thank you, Doctor.
Right. We're talking obviously about epilepsy, as you've heard. We're now going to be talking about how this condition is managed. Okay. Now, before I get back to you in terms of support, let's start with the doctor here about medical treatment of epilepsy. We've heard side effects and what have you. Let's come back to the drugs now. How do we treat epilepsy? Well, maybe I shouldn't say drugs, but how do we treat epilepsy?
Yes, there are anticonvulsant drugs that treat and manage.
You're introducing another word, just by the way, anticonvulsant. We mentioned seizure, we mentioned a fit. The other word for it is a convulsion.
Yes.
So when we say anticonvulsion, we're saying drugs that treat fits or convulsions or seizures.
Yes.
All right.
Okay. So the name anticonvulsants, came from, a convulsion is your your motor seizure.
Yeah.
So that's why it's called anticonvulsant. But anyway, it treats all type of epilepsies.
Right.
So with regards to anticonvulsant drugs, one, it's important to know the type of epilepsy that the patient presents with.
Right.
Usually when you start the treatment of epilepsy, we use monotherapy, one drug, and then we titrate it according to the clinical response.
Yeah.
And if there's no response or if one develops side effects, then we can switch to a second drug.
What do you mean by response? How do you monitor response?
I mean, to have seizure control.
Right.
For instance, if we have we're having a lot of seizures and now the frequency remains the same, or even have more seizures, then we have to review. I mean, the medication.
Okay, but in terms of the number of seizures that the sufferer has, I mean, do you when you say response, is it like if somebody has had 4 seizures a week,
yes,
which is now down to 1 seizure a week, so you'd say that's good response? Is that how you look at it?
Not really, because if you get 1 seizure a week, meaning that we get 4 seizures in a month, that's not good control.
Right.
Good control, one should at least have 2 seizures or less in a month, then the patient will be deemed to be relatively well controlled.
All right. So you're saying then the type of drug used depends on the type of epilepsy?
Yes.
Right. You mentioned somewhere about titrate. We believe that sufferers need to go in to get their blood tests. What actually do you look at there?
To titrate the medication, in certain settings, it may not be easy. I mean, to take bloods to determine the drug levels,
right,
for instance. So it will depend on the frequency of the seizures. But in an instance where sometimes one gets seizures, you increase the dosage of medication that is titrating it upwards, still one gets seizures. You have to determine whether is it indeed that the patient is taking the medication.
Okay.
Because the issue of compliance also becomes important. Yeah.
Okay. Martha, from Epilepsy South Africa, perhaps you'll take us through what is it that you do to support those that are, epileptic. I don't know whether it's the right way of saying people are epileptic, no. People that have the condition epilepsy and receiving treatment for epilepsy. Take us through what you do and how you support them.
Our vision is to ensure equal opportunities for all people with epilepsy.
Right.
And I've heard you using the word they suffer from epilepsy.
Right.
Now, we prefer to say they have epilepsy.
Right.
They suffer from prejudice and myths.
Right.
And discrimination.
Right.
But the epilepsy itself is not the problem. They can cope. It's society's attitude.
Right.
And that's purely because of people aren't informed.
Okay.
They don't know what epilepsy is. They don't know what to do when a seizure happens.
Yeah.
So our task is, once you're first diagnosed or a child is diagnosed, to be the next stop after the medical doctor.
Right.
To give information to find out what type of seizures, what medication, and to educate the family about that specific type of epilepsy. We also assist them in how to inform others around them. We will also go to schools to educate the class and the teachers on what to do in case this child has a seizure at school, or workplaces.
Right.
And often we find that the people are discriminated against in the workplace, and we will act on their behalf and mediate between them and the employer. And once again, it's mostly because of ignorance and the employer being uninformed.
Yeah. So stigma is quite a serious problem around management of epilepsy. So what I gather is that you're doing quite a lot to try and destigmatize the condition of epilepsy. And thanks for correcting me about talking about epileptics or people suffering from epilepsies. Yeah. People living with epilepsy or people that have the condition. Epilepsy. Dr. Mokaban, what is the role of nutrition and general lifestyle issues in the management of epilepsy?
People with epilepsy, I mean, they're normal people who have eat a normal diet like anyone else. But they do talk about, a ketogenic diet, which is a diet high in fat and also low in protein, in carbohydrates, for instance. And it has been shown that it can help with the control, or the management, or with reducing the frequency of seizures. Right. But others dispute that. But there are, however, others, there are studies which have shown that it does help, with management of epilepsy. And also one has to involve dietitians who are particularly trained in that area to assist in management.
Okay. And then in those that obviously are under treatment, and let's just assume that they're fairly well controlled, are there any particular things, perhaps in diet or anything, that is known to trigger epileptic fits, as it were, or seizures?
There are triggers, for seizures. For instance, things like emotional upset can trigger a seizure. For instance, a child who's teased often at school can get a seizure. And also things like sleep deprivation can also trigger seizures. Alcohol consumption also can trigger seizures. Mm-hmm. So it's very important to know those triggers for seizures. And certain drugs as well can interact with the anti-epileptic medication and thus cause one to have a low threshold for seizures. So it's important to know about all this, and that the doctor discusses all this with the patient.
Dr. Len, just your last word from you. Do you have to deal with anything relating to substance abuse and alcohol in people with epilepsy?
Yeah, sometimes we do. Mm-hmm. Because it's like doctor says, it works against the medication. So you've got to inform and educate the person to understand their condition and what to take and what to avoid. Yeah, okay. Often.
All right, on that note, we're going to have to leave it. And I suppose, I should say, thank you very much for contributing to the show. And yes, wish you well in the good work that you do as Epilepsy South Africa. All right.
Thank you.
Okay, after the break, we'll learn about first aid for seizures. Don't go away.
Would you know what to do if someone with epilepsy had a seizure? The person would lose their consciousness and their muscles would stiffen.
A gloomy Christmas for many South Africans whose jobs are on a knife's edge.
But the concern this time around is that there's certainly a spike and all sectors of the economy face risk.
Solidarity is involved in 45 different retrenchment exercises, and it cuts across all sectors.
While most retrenchments are expected in the mining and manufacturing sectors, analysts say the public sector will not escape.
So people are now sitting on their hands because the future is very uncertain.
Primetime News, daily at 6 p.m. on SABC News.
SABC, sharing 20 years of inspiration.
Zoom into Africa. This is the Republic of Congo. The president is Mr. Denis Sassou Nguesso, got independent from France on 15th August in 1960. The population is more than 4 million people. One of the major languages spoken is French. Monetary unit is CFA.
So you're going about your business at work, and suddenly your colleague collapses in front of you and starts having a fit. What should you do? Well, Dr. Mukabane is here to give us practical advice on how to handle that kind of situation. This is a very common thing.
Yes, it is common.
Right.
If one is faced with a situation where suddenly a colleague collapses and has a seizure, what becomes important is that we should make sure that the environment is safe. And move the patient from an unsafe environment and make sure...
Maybe just before that, because I think it's important that people know that it is a seizure. Maybe if you could just remind us about what is it that you notice that tells you that somebody's having a seizure?
What you would notice is that suddenly somebody collapses and they start jerking.
Right.
They're jerking uncontrollably. They're unresponsive. You call them by name, they're not responding.
Right.
Then sometimes they may foam in the mouth.
Right.
Then suddenly you realize this is a seizure. Then make sure that the environment is safe and put the patient on a lateral side so that they do not aspirate. Because if they're in a supine position, the position where they're facing up, it's easier for them to aspirate because the airway is compromised.
Okay, so you literally put them on their side.
Yes.
Okay.
Yes.
Okay, and the idea is that you're saying if they vomit, they shouldn't.
They shouldn't. Yes.
Swallow the vomit.
Yes, and also what becomes also very important is the misconception that if somebody gets a seizure, they will swallow their tongue.
Yeah.
And people usually they'll put objects into the mouth.
Yeah.
They should shy away from doing such things.
Well, you know, this is it's a very important one because we all grew up knowing that if a child in the school that you attend has a fit, there's this thing that you must protect the child. You must protect the child's tongue because the child is going to swallow the tongue. So you're saying nonsense.
It's practically impossible to swallow one's tongue.
Right.
Yes.
Okay. All right.
Yeah. So information is very important.
Yeah.
Yes. And
then so we were taught that this is going back quite a few years ago.
Yes.
That you take a ruler or any object, you put it in the mouth so you protect.
Yes.
The other reason given was that in a fit, people can actually bite their tongue. So to protect their tongue, you put something in between the teeth. Any merit in that?
Of course, yes. They do. People with epilepsy, they do bite their tongues. It's when they have the generalized seizures,
right.
They can bite the tongue. Yes, that's another important thing to note as well.
But so what should people do? Should they put stuff in people's mouths?
No, they shouldn't do that. It's against that because one, they can swallow. The objects that they put into the mouth and even pose more harm. By doing that.
All right.
Yes.
Okay. So the environment, make sure that the environment is safe, the person is lying on the lateral side, and you don't touch the mouth or put any funny things into the mouth.
Yes.
And then what next?
And if usually a seizure doesn't last for more than 2 minutes. If it goes beyond that, then one has to call for help. If it's possible for the people to take the patient to the hospital, that can be done. Otherwise, they should ask for the emergency services, for an ambulance, call for an ambulance for assistance. Yes.
So if a fit lasts for about a minute or so or less, so you're saying when the person recovers, no need to take the person to hospital, or what do you suggest?
What becomes, you have to find out if they took the medication. And sometimes we can give even more medication at that moment if they have it at their disposal. But as a general rule, it is better that even after the seizure has passed, just take the patient to a healthcare facility.
Okay. Yes. Right. Clearly, there can also be other things, that go wrong in the body that can result in a fit.
Yes.
We believe a stroke, a heart attack, and that sort of thing. Any comment on that?
Yes, it's interesting to know that in elderly people, for instance, they can suddenly present with new onset seizures and only to find that they have a stroke. So there are other things that can result in a seizure other than just idiopathic causes for seizures. And someone can have a seizure as a result of a tumor in the brain. So with all new onset seizures, they have to be properly investigated by the proper clinical examination and also by brain imaging, either a CT scan of the brain or MRI of the brain.
Okay, so for someone either at home or in the office suddenly is confronted with this person that's having a fit for the very first time, so what you're saying is, the message is, yes, make sure that the person, is in a comfortable environment and you don't put things in the mouth. And then thereafter, make sure that the person is taken to hospital. You call for help, call for an ambulance.
Yes.
Okay. What about a child? A child fitting for the first time, because we are told that. Maybe let me put the question to you. In children, is anything like every fit or seizure equals epilepsy. Is that true?
Not only in children, one seizure doesn't equal epilepsy.
Yeah.
Because there are other causes for seizures.
Right.
Like electrolyte imbalances, low sodium in the body, low glucose in the body, even infections can cause one to have a seizure. Meningitis, for instance, can complicate with a seizure.
Yeah.
So a seizure doesn't equal epilepsy.
Okay.
So if we go back to the definition of epilepsy, where we say that epilepsy is a chronic neurological condition that is characterized by 2 or more seizures.
Okay.
That is a recurrence of seizures.
All right.
And these seizures should not be provoked, meaning that there should not be an immediate reversible cause to the seizures.
Yeah. Yes. Okay. Maybe just going back to children, just latching on this, that some of these seizures happen at night when they're sleeping, and it may not be easy for parents to notice. Your comment?
Yes, there are nocturnal seizures.
Right.
And actually, if somebody presents with a nocturnal seizure, that is a true seizure. Yes. So we do have nocturnal seizures, and such children as well have to be put on medication. Yes. There are nocturnal seizures. We have a genetic component, and also, idiopathic, nocturnal seizures as well, which warrant a proper investigation and treatment.
But in terms of how they handle then for parents, now any child that has a seizure, same principles rather apply, that you keep the child safe, but if it's the first time that the child is having a seizure, take the child to hospital.
Yes.
Wow. Okay. Well, it's been a very valuable and informative session, and I want to thank you very much for contributing to our show, and I think that obviously the viewers watching found it useful as well. Okay, it is on that note that we come to the end of our show today, and if you'd like more information on epilepsy, you can contact Epilepsy South Africa at 086 037 4537 or call them at 021 595 4900. Simply pop them an email at info@epilepsy.org.za. Okay, and their website obviously at www.epilepsy.org.za. So join us again next week on SABC News and watch our repeat slots at 2 p.m. and 10 p.m. Alternatively, you can view us on our YouTube channel. So from me, Dr. Sello Motaung, and the rest of the team, it's a warm goodbye. Thank you for watching and happy holidays.
You ask? This is who we are.
We are technologically driven.
We are unashamedly Afrocentric.
We advise you not only on legal matters,
but on health issues as well.
We bring imagination to life.
We celebrate arts and culture and lifestyle.
We tackle life challenges head on.
We dig deep. We probe. We question.
We invite you to take a view from our house, as we tell it without fear, separating fiction from factual.
We are the SABC News Channel.
All news, all global, all the time.
Should marijuana be legalized in South Africa or not?
The legalization of dagga is a no to our country. Look at the rate of rape in our country because of people that
But you can't say dagga makes people
that
get
are under
raped
the
then.
influence of dagga.
When a young man comes to you and says, I'm having a problem with dagga, do you send him to jail?
We don't send them
Then
to
you already concede that you agree that prohibition is not the answer, Ms.
because
Mapanga.
our aim is to help them.
As is ours.
It is You're helping them by giving them dagga. How are you going to control this? Just give me a chance. Because if you cannot control it now, as the CYP of South Africa, we say no to the legalization of dagga. No matter what you study, no matter what you tell me, I say no.
Watch Newsroom with me, Eben Janssen, weekdays at 9 a.m. on the SABC News channel.
The rolling hills of KwaZulu-Natal are home to a great